Thank you, sir. I think my job has been done much easier. Why? Because Dr. Arvind has illustrated a lot of things. But just to add on to a couple of other points, which of course is related to tirzepatide. Now we'll be talking about head-to-head comparison with the conventional GLP-1 RAs. So these are my disclosures. So tirzepatide actually has been studied comprehensively once the development program was going on, and it involved more than 6,200 participants across all different stages of type 2 diabetes with active comparators. Now, it has been compared and looked as a monotherapy, of course. It has been used as add-on to various oral anti-diabetic agents. It was being compared with semaglutide. It was compared against insulin degludec with add-on to metformin with or without SGLT2 inhibitors. In Surpass 4, it was compared against glargine, of course, with an addition of 1 to 3 orally antidiabetic agents, which included metformin, SGLT2, or sulfonylureas. And of course, in Surpass 5 again, versus placebo add-on to insulin glargine with or without metformin. Now, what was interesting? So, if you look at uh, these trials across, you'll see the mean age of diabetes across all these trials are different. So the mean age of type 2 diabetes varied right from 4.7 years to even 13.3 years. That means this therapy was actually tried across all stages of diabetes and across all array of treatment alongside. So that was pretty interesting. So we'll be talking about Surpass 2 specifically over here, which included more than 1,800 patients and with a mean type 2 diabetes duration of 8.5 years. So this is basically just to showcase how the SURMOUNT trials looked like. So tirzepatide for weight management was evaluated in robust clinical trial program involving more than 5,800 participants in series of SURMOUNT trials, right from SURMOUNT 1, 2, 3, 4, and 5. Uh, they had different comparators, of course, primarily looking at the weight management. In the Surmount 1, the placebo was in fact taken. It was 72 weeks studied involving more than 2,500 patients. Surmount 2, weight management with type 2 diabetes, when it was again compared against placebo. 3, weight management after intensive lifestyle modification. That was interesting because after intensive lifestyle program of 12 weeks, the patients were randomized in two different groups and they were again followed up for 84 weeks. And Surmount 4 actually looked at the weight maintenance part of it. 5 looked at the weight reduction compared to the semaglutide, of course, and that is something which we're looking forward to in this presentation. So, of course, these are the approved indications which we have for tirzepatide. That's type 2 diabetes and chronic weight management. It is indicated for the treatment of adults with insufficiently controlled type 2 diabetes mellitus as adjunct to diet and exercise, as monotherapy when metformin is considered inappropriate or intolerable, or it is contraindicated, in addition to other medicines for the treatment of diabetes, of course. Where for the chronic weight management, it's been indicated as an agent to the reduction in the calorie diet and increased physical activity for weight management, including weight loss and weight maintenance, especially having patients BMI more than 30, which are who are labeled as obese, more than 27, in presence of at least one weight-related comorbid condition that can include hypertension, dyslipidemia, obstructive sleep apnea, cardiovascular disease, prediabetes, or type 2 diabetes. So we'll be specifically looking at tirzepatide and comparing it against the semaglutide for the people living with obesity. So just to give you a background, tirzepatide and semaglutide, of course, we already know the mechanism of action. One is GIP and GIP-GLP receptor agonist, and second is plain GLP-1 receptor agonist. The mean weight reduction, which has been actually seen in a variety of trials, which we just mentioned, in tirzepatide is around 22.9% weight reduction after nearly almost 3.5 years, whereas semaglutide also offers good weight reduction up to 6.7% after nearly 2 years. Now, it is hypothesized that dual agonism of tirzepatide is more effective, and since it is acting by complex pathways, which actually limits the ability to achieve the maintain reduced weight compared to the plain GLP agonism. So head-to-head clinical trials are interesting to answer these questions, and we have surmount 5 for that. So tirzepatide was compared against semaglutide in this study. The highest dose of tirzepatide which was used in this particular trial was 15 milligram, of course, as a maintenance dose, 10 or 15 milligram. Whereas for semaglutide, it was the 1.7 or 2.4 milligram, which was these are the actual doses which have been labeled for treatment of obesity related complications, excluding diabetes. So it was again a phase 3B multi-center randomized parallel arm open label active comparator trial, which included more than 750 participants. The primary endpoint was looking at the percentage change in the body weight from the baseline to the end of 72 weeks. And of course, even at the 72 weeks, the the figures which we are actually expecting right from the beginning, they were pretty much there as well. So if you see, the tirzepatide actually again favored weight reduction way higher compared to semaglutide. So there was almost 21.6% weight reduction compared to semaglutide, which only offered 15.4% weight reduction. So 1 in 3 participants taking tirzepatide achieved more than 25% mean reduction in the body weight versus 1 in 5 taking semaglutide. So that is quite phenomenal. You see, 36.2% of participants taking tirzepatide demonstrated mean weight reduction of more than 25% at 72 weeks. And this is against semaglutide, mind you, in SURMOUNT 5 study, which only offered 19.4% on an average. Participants who were taking tirzepatide also experienced superior reduction in waist circumference. So it was not only the overall weight, because we are actually looking at the body composition overall, even while initiating tirzepatide. And of course, it did offer a lot of significant weight circumference reduction at the end of 72 weeks, almost to a tune of 20 centimeter, which is approximately 7.9 inches, against the semaglutide, which only offered 14.7 centimeter waist circumference reduction. Now, the adverse reaction, of course, are much concerned, but overall, safety of tirzepatide in SURMOUNT 5 was like previously reported SURMOUNT trials. There were no major adverse events. So, majority of them had GI adverse events, which were mild to moderate in nature, and they usually occurred during the dose escalation, and they usually decrease over a period of time because the patient became developed some tolerance to that. And similarly, in semaglutide as well, they are of that sort. So it was pretty well tolerated in either of the arms. So redefining type 2 diabetes, if you talk about tirzepatide, it demonstrated superior mean A1C reduction across all 3 doses when once compared to semaglutide. Well, the dose of semaglutide which we actually use for the treatment of diabetes is, of course, the maximum dose of 1 milligram. So if you look at that dose comparison, you will see semaglutide offering a average A1C reduction of 1.9% compared to tirzepatide, which at the least dose, that's 5 milligram, offered 2.1% A1C reduction, which is quite phenomenal. Again, greater number of patients achieve A1C targets across all doses of tirzepatide, and once compared to semaglutide 1 milligram, it did show a significant improvement. Now, very interesting thing to note over here, if you look at number of patients achieving that weight or A1C target of less than 5.7, you'll see 51% patients achieve A1C less than 5.7 at a dose of 15 milligram tirzepatide. That means great amount of chances being there for diabetes remission as well with tirzepatide, and with semaglutide they were pretty less. Now, even for the people living with diabetes, it did demonstrated superior mean weight reduction across all 3 doses. And of course, once you compare with semaglutide, the average weight reduction was way lesser compared to tirzepatide. So it was again found superior in terms of weight reduction in these diabetes trial when it was compared to semaglutide over a period of 40 weeks, where it was compared to 1 milligram semaglutide. So more patients actually achieve the composite endpoints with tirzepatide compared to semaglutide 1 milligram. And looking at them, the statistics shows you at the highest dose, 60% of them achieved. At 10 milligram dose, they achieve almost 51% patients achieve those endpoints. And with the least possible dose, that's 5 milligram, even 32% patients achieve those endpoints. And looking at semaglutide, only 22% patients achieve those endpoints. So, of course, almost 3 times if you see the highest dose comparison. Of course, the most common AEs of tirzepatide and semaglutide were actually comparable, and they are mild to moderate in nature, mostly GI related, as seen in the other trial, the Surmount trial as well. So not much of a concern. Hypoglycemia, this instance of hypoglycemia or severe hypoglycemia, were almost negligible. So that's something which is very important because that's the reason they can be used even in pre-diabetic and non-diabetic populations. So just to summarize, tirzepatide significantly reduces the body weight by an average of 16% with a dose of 5 milligram and 22.5% on a highest dose of 15 milligram. It also demonstrated superior weight reduction once compared to semaglutide, and which is quite phenomenal. Of course, an A1C reduction was also quite robust, with semaglutide was much lesser, and with the tirzepatide, it was maximum weight. The A1C reduction was almost 2.5%. The most common adverse reactions were GI in nature, and they're almost mild to moderate in nature. So improvement in the cardiometabolic parameters in SURPASS and SURMOUNT trials was secondary endpoints. Tirzepatide was found to be safe from all CV perspective. With this, I would like to conclude, and I would like to answer any queries if you're having any.